President Obama today tapped Joe Biden's former chief of staff to head U.S. efforts to fight Ebola. Ron Klain is also an Indianapolis native. He was born there and graduated from North Central High School. Obama's decision is the latest step in the country's efforts to control the Ebola epidemic. Medical experts are emphasizing it's unlikely the U.S. will experience an outbreak here, but that doesn't mean Americans shouldn't be concerned. As Barbara Harrington reports, 2 Indiana University doctors were in Liberia earlier this year as the outbreak started, and they saw firsthand how deadly the disease can be.
Adama Dabo doesn't have much spare time.
My concentration is public health administration, and also I'm doing my second master's in African studies.
She spends most of her time studying. Dabo came to Indiana University about 4 years ago, and her passion for helping people seems to run in the family.
My mom and my older brother work at the hospital. Both are medical doctors.
They're working in her native country of Guinea, where the Centers for Disease Control says more than 1,000 cases of Ebola have been reported. The medical professionals tasked with treating the disease run a high risk of contracting it themselves.
They are a little bit worried about, the risk of contamination because some of their colleagues, got the disease. Some died and others survived. So where they are working right now, that environment is a little bit risky.
It's especially risky because West Africa has a severe shortage of healthcare workers and medical supplies, making containing Ebola difficult.
The health system collapsed because healthcare workers didn't have any protective equipment. And, almost in the very beginning, a fair number of them contracted and died of Ebola. And, the rest of the health workers there got the message, gee, we don't have anything to keep us from getting Ebola. I'm not going into work.
Indiana University hosted a forum earlier this week focusing specifically on the outbreak in Liberia, where the CDC reports more than 4,000 cases of Ebola. The co-directors of IU's Disaster Medicine Fellowship program recently traveled to the country to help hospitals identify their vulnerabilities and determine how to respond in the event of a crisis. Their work wasn't supposed to be focused on Ebola, but that changed when the first case came into Liberia's JFK hospital where they were working.
This patient ended up being in the hospital for 6 hours, and subsequently he died shortly after we recognized that he probably did have Ebola and tried to move him to isolation. And subsequently, 2 of the doctors who handled that patient, or actually 3 of the doctors who handled that patient, ended up contracting Ebola from handling that patient, and only one of those 3 doctors survived.
After that, they tried to restrict access to the hospital and track down all of the people the infected man came into contact with during his 6 hours there. That proved to be difficult.
We had a couple of janitors who were helping move the body, and we couldn't even get their names because I don't think anybody actually knew their names. And so we could not effectively trace who those people were and whether they ended up becoming symptomatic and needed to get treatment later on down the road.
Hospitals in the United States are now working to make sure they're adequately prepared to treat Ebola. In some cases, that means training staff on proper protocols and reviewing quarantine procedures.
We should not be surprised that diseases affecting other countries will affect us, and we should take reasonable precautions every day.
3 cases of Ebola have been confirmed in the U.S. A man traveling from West Africa to Dallas died at Texas Presbyterian Hospital earlier this month, but not before infecting 2 people who were treating him. While the incident is cause for concern, Assistant Dean for Operations and Community Partnerships at the Indiana University School of Nursing, Chad Priest, says there's no reason to panic. He says fears of Ebola becoming an epidemic in the United States are overblown.
We will not have a large outbreak of Ebola in the United States, but we will have a large outbreak of something. We will have another serious epidemic. in the United States.
I think there's much more important things that we need to be concerned about as a country. We need to be concerned about the influenza that happens every year. We need to be concerned about measles that's making a comeback. We need to be concerned about enterovirus, which is affecting our kids in the Midwest. So I think there's other things that will probably have a bigger impact in the U.S., but it's certainly understandable that people are afraid of Ebola.
Mugel and Priest say that fear should be funneled into action. While Ebola may not pose a large threat to the United States, they say countries have a responsibility to step in and help stop the outbreak.
Our ability to stop Ebola in the United States is directly related to our ability to stop Ebola in Africa. And that's going to be the same for the next pandemic influenza, wherever it emerges. We're just going to have to get more comfortable as a nation going overseas and viewing that help to those places as more than just charity, but really part of our survival.
We have the resources to help them, and not to help them would be, just morally a difficult position to maintain when you're able to help.
It's a message Dabo is taking to heart as she prepares to graduate in May. She feels a responsibility to go back to Africa and help her people, even if it means putting her own health at risk.
We know there is a shortage in terms of health professionals, in terms of a lot of things, so maybe we can impact our community.
Doctors say Ebola is difficult to catch. It can be spread through bodily fluids, infected animals, or contaminated objects like syringes. There is no FDA-approved treatment for the disease.